The Katsina State, where the Voluntary Service Overseas International arrives in the state, which is in the northwestern part of Nigeria, to give students an opportunity to observe a science laboratory in operation. The organization wants to see an improvement in teaching of mathematics and science subjects in the state.
Literacy in Katsina State has been described as relatively low for varying reasons, such as inadequate teachers, low student motivation, among others. And in a bid to increase the stakes in education, the Katsina State government has welcomed the Voluntary Service Overseas International, a non-governmental organization which aims to train children in science and mathematics, two areas where literacy is low.
This good work and the evidence that we get from it will inspire the government, private sector, civil society organizations to join us in this bid to ensure that the students of tomorrow are not left behind.
While the Katsina State government lauds the efforts of the organization, the state governor promises sustainability of the initiative, even after its ceremonial launching.
We assure him that we'll do everything possible, working with the Ministry of Education to make it sustainable. So that is what is most important, sustaining it up after the ceremonial launching, to make it functional, sustainable, and from there we can take it to the next level.
Teachers as well as the students are excited about the learning approach. They believe the process can indeed be fun.
Before the availability of this van, there's nothing like that. They find it difficult to even handle some apparatus like test tube, beaker, even material range. They find it difficult to say, this is it, or identify some of the equipment needed for the practical. But right now, or because of the availability of this mobile lab, they have been able to do any practical subjects on their own, especially based on chemistry, biology, and physics.
The organization is expected to make rounds in as much as 15 public schools in Dutsi and many local government areas of the state.
From education, we talk agriculture. Consumers in Ogun State, southwest Nigeria, can now begin to get more value for their money as the state government introduces standard measurements for grains and other foodstuff in the market. The State Commissioner for Commerce and Industry, Mr. Bimbo Ashiru, says the move will also protect consumers from malpractices.
We found out that different measurement bowls are being used, and the consumers don't get value for their money. And we want consumers to get value for their money. If you are buying a Congo of rice, you must be sure that it's a Congo of rice. I mean, it's just like a bag rice is not a problem. If you have a bag, 50 kilos, 10 kilos, 20 kilos, but it must be properly measured, because see, not everybody can afford a bag of rice or a bag of gari. So some people, the little one they can afford to buy, maybe 400 naira per Congo or something like that, but they must have value for that. And that is, and actually, this is actually meant to protect our lower level people that cannot afford to, I mean, they are trying to make it to have ends meet, then they cannot afford to be cheated for that. So that's why we are ensuring that they meet the deadline and they actually abide by the rules.
To health matters now, we go back to Katsina State, where the wife of the governor, Hadiza Masari, is appealing to pregnant women to take antenatal care more seriously. She made the appeal at a general hospital where a set of quadruplets were admitted following the death of their mother. The appeal is coming on the heels of a report from the Health Ministry that Nigeria has one of the highest cases of maternal mortality in the world.
These are the final moments of 32-year-old Gaje Zubeiru before she died on October 29th after giving birth to quadruplets in a hospital in Katsina State. One of the babies died a day after she was born. The deceased already has 10 children before giving birth to the quadruplets.
She came very late.
The chief medical director of Malumfashi General Hospital, Katsina State, where the deceased had her babies, explains that the late Gaje Zubeiru was rushed to the hospital on Tuesday, October 24th, while in advanced labor.
She came very late with the issue of no ANC attendance. Number two, she has multiple pregnancies and the uterus is already lax now. That is why if somebody has usually more than 4 pregnancies, so there is tendency of having postpartum hemorrhage, even if it is vaginal delivery. So that is what she had. She had postpartum hemorrhage. At our level, the man doesn't have even 1 naira when he came. So we have to give them bloods, antibiotics, IV fluid, everything the hospital gives from its revolving funds. We give her free. And even after the surgery, he didn't come until 2 days after the surgery. So that is why when he started getting the donations, we told them that we are not going to be giving him this money, because if you give him those money, in the next 2-3 weeks he will marry again to fill this gap.
Zubairu Gura is the husband of the deceased. He has 4 wives, including the deceased, and 25 children.
Lokacin wani zubin zaka tashi da niyyar zaka je din kuma baka da abin da zaka bada can kauyen. Abin da za a hawo ma babur din a zo shine ma hanyar ma ita ke da matsala.
Suwaiba Salisu is a daughter to the deceased. At a young age, she's already a mother of 3 children.
Ina kira ga yan uwana mata daga yanzu an dau ciki ya kai matsayin wata 3 a daure a rika zuwa awo saboda lahiyar mu da lafiyar yaran mu.
The wife of the Katsina State Governor is among the sympathizers who have been visiting Malumfashi General Hospital in the state to condole with the family and render assistance to the husband of the deceased.
If there is any need that they need assistance, the door is open for me to do all what I can for them. My campaign to women is to come to the hospital and render for antenatal care.
According to the Minister of Health, Professor Isaac Adewale, Nigeria is the 2nd country with the highest maternal mortality rate in the world, contributing 14% to global maternal mortality. He says current statistics indicate that Nigeria's maternal mortality ratio is 576 per 1,000 live births. Contributing factors to the high maternal mortality rate are largely lack of access to or use of quality delivery services, and experts are appealing to government at all levels to address this concern.
A really sad one coming there from Katsina State, but some cheery news in Yobe State. To prevent some people from going blind, 240 patients from Yobe State North Central Zone are undergoing free surgical operations. Beneficiaries of the free treatment scheme were drawn from the 6 local government areas of Yobe North.
As part of efforts to address health complications in Yobe State, northeast Nigeria, 240 patients are currently undergoing various surgical operations to tackle hernia and hydrocele. Drawn from the 6 local government areas of Yobe North, patients from Mashina, Unguru and Karasua are being attended to at the Federal Medical Center, Unguru, while those in Jakusko, Yusufari and Bade are in Gashua. They were recommended for surgery out of the 600 patients screened for the treatment. The remaining will only be treated and discharged.
Most of these patients will not have been able to afford the cost of the surgery. And a lot of them might not even be aware that such condition can be treated, as it is a common knowledge that there is a lot of superstitious belief attached to it. And many are even ashamed to let people know of this condition. The center is very much prepared to start the surgeries, as all the preliminary screening has been completed and patients have been recruited.
Here in this hospital alone, we are handling more than 80 patients with these various crucial conditions. So many of the patients go around with these crucial conditions, basically because they cannot afford treatment.
Elders from the communities are quite pleased with the development.
Whatever that one can do, without a good health, then you can't do it. So he's making his own little contribution to make us healthy and to make the community whom he is representing healthy. So we appreciate.
Pray Almighty Allah that this program is successful and beneficial to all of us.
Senator Ahmed Lawan, who flags off the scheme, says those not attended to will be considered in the next phase.
This may be the beginning for this particular element, but it may be the phase 1 because I was told that some patients have not been captured. It is my desire that we find accommodation for them and have them treated of the ailment as well.
The free treatment scheme, which is to complement the health policy of the Yobe State Governor, Ibrahim Gaidam, will go a long way towards tackling some of the health issues in the state.